Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi. So in this video we are going to look at contraceptives, the types, the benefits, the side effects and all. And if you are new to this channel or if you haven't yet liked this channel, please do like, share and subscribe. So what are contraceptives? Contraceptives or birth control methods are techniques or medications used to prevent pregnancy. Some also protect against sexually transmitted infections. And there are various types of contraceptives. So I'll start with the hormonal methods first. So for hormonal methods of contraception, these work by inhibiting ovulation, thickening cervical mucus, or altering the endometrium. So under hormonal methods, we also have various subtypes. So type number 1, these are pills, and examples include things such as combined oral contraceptives or progesterone only pills. And for the duration, so these ones you have to use them daily. The advantages are that they control acne, so there's acne control and there will be regular periods. But for disadvantages is that you have to use them daily, so the pill has to be taken daily. They can cause nausea and there is no STI protection. Coming to injectables, it's under hormonal methods as well. So we have examples such as the Depo-Provera, and the duration you have, it works for 3 months. The pros is that it's convenient and effective, and for disadvantages or cons is that it causes weight gain and delayed return to fertility. So also under hormonal methods you can have things such as implants, such as the Jadel, and these work within 3 to 5 years. The pros, it's very effective long term, but for disadvantages there is irregular bleeding. A minor procedure is needed to insert a Jadel. You can also have things under hormonal methods such as the patches and the vaginal ring. Coming to barrier methods, these block sperm from reaching the egg. So for instance, this is where you find the male and female condoms. And for male condoms, you can have latex or polyurethane. The pros are that it protects against STIs, and the disadvantage is that it may break or slip out and it reduces sensitivity. For female condom, you can have polyurethane pouch. Also, the pros is that it protects against STIs. And for the disadvantage, some find it noisy and harder to insert. So under the barrier methods, you can also have things such as the diaphragm or cervical cup. So this cup is dome-shaped device and mostly it can be reused. And for the disadvantage for this one, it must be used with spermicide and it does not protect against STIs. Coming to the third method of contraception are intrauterine devices. Mostly there are two. There is copper IUD and hormonal IUD. So coming to the copper IUD, mostly it works even for 10 to 12 years, and the mechanism of action is that it causes a toxic environment for sperms. And for the advantage is that it's long-term, long-lasting, and it's non-hormonal. And the disadvantage is that it can cause heavy periods and cramps. Coming to the hormonal IUD, this one can work within 3 to 7 years. The mechanism is that it works by thickening mucus and thinning the endometrial lining. The advantage, it's also long-term. But for the disadvantage is that it's costly mostly and requires insertion by the health provider. And we also have permanent methods such as tubal ligation and vasectomy. We can also have emergency contraception as another method of contraception, and these are used immediately after unprotected intercourse. And for the methods include emergency pills, which works within 72 to 120 hours. And And we can also have an IUD as an emergency contraception, which can work within 5 days. We also have natural methods of contraception. So these methods include things such as the calendar method, or the withdrawal method, or the lactation or amenorrhea method. So coming to these methods, these are based on fertility awareness and abstinence during fertile periods. For the calendar methods, for example, you have to avoid intercourse during ovulation. And for the withdrawal method, mostly the penis is pulled out before ejaculation, and this also comes with high failure rate, so you have to take note of that. And for lactation or amenorrhea, this has to do with breastfeeding. So while breastfeeding, this is also a method of contraception, and it's effective if less than 6 months postpartum, during that exclusive breastfeeding period phase. So coming to the effectiveness of these contraceptives, you have to know that for implants and IUDs, they are mostly effective 99%. For pills, patches, and rings, mostly 91%. For condoms, both male and female, for male it's mostly 85% effective. For female, 79%. And for withdrawal is 78% effective. For emergency contraceptives, they depend on timing, so the effectiveness can be somewhere between 58 to 89%. So what's the benefits of contraceptives? So they prevent unplanned pregnancy, they help manage menstrual problems, they treat acne and polycystic ovarian syndrome, they can reduce risk of some cancers, they can promote family planning and empowerment. But then these come with side effects also, such as nausea, breast tenderness, mood changes, irregular bleeding, and weight gain for some, especially with injectables. And sometimes there are contraindications for the use of some of these contraceptive methods. So for instance, for the combined pills, these should be avoided in smokers who are more than 35 years, with history of hypertension or thromboembolism. And for IUDs, mostly they are avoided in people with active pelvic infection or unexplained bleeding. For emergency contraception, so these are not suitable for everyone, so you have to take note of that as well. So that's just a brief discussion on contraception. I hope to see you in the next video. Thank you for joining today.